This episode is brought to you by Bound Hat Company. Discover Bound Hat Company, where high-quality hats meet a greater purpose. Each hat is designed not only for style, but also to give back, with proceeds supporting charities like the PTSD Foundation of America. Whether for the outdoors or everyday wear, Bound Hat Company has the perfect hat for any occasion. Shop now at www.boundhatco.com and join the movement to support veterans and meaningful causes. Bound Hat Co. Style that makes a difference.
The following podcast discusses sensitive topics. Listener discretion is advised. If you or someone you know is struggling, call or text 988 to reach the Suicide and Crisis Lifeline for 24/7 confidential support.
Welcome to Survival in the Trenches, Life Beyond Loss, a podcast where we share the powerful stories of those who have faced extraordinary loss and found the strength to push forward and triumph. These are real journeys of resilience, courage, and hope. Join us as we uncover what it means to rise above, even in the darkest of times. Hello, everyone, and welcome to Survival in the Trenches. My name is Kelly Chandler. I will be your host. Today, we are honored to sit down with Dr. Rebecca Lester, associated with Washington University in St. Louis's Healthy Mind Lab, and CHIRP, which I will have you explain, that wonderful new acronym. Thank you for being with us today.
Oh, thank you for having me. And CHIRP is the Center for the Holistic and Interdisciplinary Research in Psychedelics.
That's a big acronym.
It's a mouthful.
Yeah, it is a mouthful. I can see why you went with CHIRP.
Yes.
So once again, thank you. This is an incredible opportunity that not a lot of people get access to speak with people in your position that are doing such groundbreaking work in the area of psychedelics. And before we get into what the Healthy Mind Lab is doing and CHIRP is doing, I wanted to share with our listeners a little bit about you and your background and how you got here today. So if you don't mind, maybe taking us back in your life, and let's talk about you.
Great. Yeah, sure. So I'm an anthropologist. That's my PhD is in anthropology, and I'm also a licensed clinical social worker. So my research is in culture and mental health, and particularly I'm interested in American psychiatry as a cultural system, and so how people work within psychiatry to understand what mental distress is and how to best address it for different populations in different contexts.
That's incredible, and we hear so much, just as the general public, that mental health is such an important issue, and I feel like we're getting there, but I don't know what that means. So there's so much talk about being able to express mental health challenges, and how do you go about assessing that, for our country and where we're moving with the acceptance and support in those types of services for people?
I think there's much more recognition of the need, particularly post-COVID. During COVID, there was such a spike in anxiety and depression and other struggles that people were having that was recognized as a phenomenon, and that we definitely need more services. So that's good in the sense that it spurred that awareness, but we are still very far behind where we need to be in terms of addressing the needs that our population has.
Absolutely. So you're looking specifically at our country.
I am. I look some cross-culturally, but my interest is really the United States, because there's a lot to learn about what's going on here.
Absolutely. And can you tell us a little bit more about your personal background and some of the things that you've been through on a personal level that maybe pushed you to get into this line of work?
Yes, absolutely. So I have been interested in anthropology since I was a kid. I don't know how I learned about it, but ever since I was a kid. And part of what drew me to it was my own experiences with the mental health system in American psychiatry. I had an eating disorder when I was 11 and a recurrence when I was 18. And both those times I went through the whole treatment process, and thankfully things are in a good place now. But those experiences, even at the time, I remember thinking very clearly, like, there has got to be a better way to address this particular thing. I mean, as well as other issues within our mental health system, but particularly with eating disorders. I was like, this doesn't work very well, what we're doing. Of course, that was a long time ago, and a lot has changed since then, but there are still really deeply embedded problems in the way that our society thinks about and treats these conditions. So my most recent book was really exploring, how did we get here, where it is the second most deadly psychiatric condition that exists, just behind opioid addiction, but it is dramatically underfunded, sometimes excluded from insurance coverage. There's just so many barriers to people getting adequate treatment. And so the book is really exploring, how did we get to this? Why is this way? And then it takes a really close look at a treatment center and looking at how does this affect relationships of care? How does it affect patients and clients' progression through recovery? What are the kind of double binds that get set up that keep people from getting well? So it explores all of those kinds of issues.
So it sounds like for you, you turned your, at the time, what was a painful experience and probably extremely traumatic mentally, into purpose.
Yes.
You dove deep. You decided, I'm gonna fix this problem.
That's right. That's right. So that really motivated me all the way through my graduate education and into this most recent work that I've done.
Which is, it makes sense. It's a logical link because in my mind, and I know very personally someone that struggles with eating disorders, and it's such a mental problem. It's a mental challenge.
Yes.
And so I can see where you progressed into this additional line of work where it's not just eating disorders, it's beyond.
Right, because so much of how people experience their distress has to do with how a culture understands what's normal and what's not normal, and what's healthy and what's not healthy, and what kinds of supports are in place to help people if they're struggling. And so if we look culturally at all of that stuff, we can get better insight into how people then experience the struggles that they're having and how we can maybe help them in a better way.
That's fascinating. So take us back also how you got from there to now getting into psychedelics.
Yeah, sure. So as part of my eating disorder research, I went back and got clinical training as a clinical social worker, because I've always had an interest in actually, we can study things and learn about them, but what do we do with that? So I was very interested in okay, I want to learn how to do stuff. And so that has really shaped the way that my research has progressed and just the things that I get involved in. And so when I heard about Leo Cabasa and Ginger Nickel putting together this research center on psychedelics, and they asked me would I have any interest in it. And absolutely. I mean, psychedelics is something that anthropologists talk a lot about, so we can touch on that if you'd like. But it's something that is a topic of discussion within my other discipline that I work in, and it also has this potential to really revolutionize how we think about and treat mental distress.
Which is so exciting, I'm
Yes.
sure, as someone who has been in that world. And as you suggested, I would love to talk about how psychedelics has been viewed from the anthropology perspective, if that's what you want to call it.
Sure. Well, in our society, we think of psychedelics as drugs that are illegal for the most part, and dangerous, or these kinds of things. They have a certain kind of association with them culturally, but through the span of human history, they've been part of our culture. Our cultures are all around the world. I mean, these kinds of compounds, and particularly like with mushrooms and things like that, they grow all over the world. And so humans for millennia have been utilizing them for a variety of different reasons, for medicinal reasons, for ritual reasons, for religious reasons. So it's fascinating to think about how that transition has happened, where now they're classified as something that's kind of dangerous and scary. And when for most of human history that has not been the case, they've been very accepted and integrated as part of our kind of healing systems.
And with the drug, with the effects of the drug, there comes a guided experience.
Yes.
So can you talk about that? Because as someone who has no experience in this arena, I want to know how that works, how the drug works with that guided process.
Right. Well, there's certainly different ways of doing it, but generally speaking, it's useful. And this also is across millennia and across cultures and everything, to have a guide who is someone who's more knowledgeable about what your experience might be and can help walk you through all the kind of unexpected or unanticipated, you can't possibly anticipate what exactly it's going to be like. And so having somebody there to help you make sense of that experience is really critical, because it can be really life-changing. And so to have somebody there who's more knowledgeable to help you kind of contextualize that, make sense of it, afterward integrate it into your sense of who you are, your sense of your place in the world is really important.
It's fascinating. So tell me what you're doing. Like, what is your typical day like when you're looking at this research? Are you getting involved with the patients that are going through the studies on like the front end? Like, what is your role?
So it's evolving. So at this point, we're setting up the center and we're kind of defining our research questions and things that we want to study and understand. I'm going through the training right now to be a facilitator, which is the person who's in the room as somebody is having one of these experiences. So all of the facilitators are trained clinicians as well. So you have, people who know what they're doing, and there's I'm finding a very long training that one goes through, which is appropriate. So that I will be involved in that as well once that is complete.
So is that, for lack of a better term, a guide?
Yeah.
Okay.
Yeah.
So it's basically, or they call them shamans. I mean, I'm trying to understand all the different terms as someone who doesn't have a lot of background in this.
Right. So I would say what's a little bit different about the facilitator role is that because we're doing a research study, we're there to kind of put some guardrails up and be there to support people, but not to shape the experience, because it's really important for them to have their own experience, whatever that's going to be. Whereas a shaman might be a little more directive in helping you make sense of what's happening. Okay. A facilitator is more, there for safety and to facilitate you having your own experience as opposed to directing it.
Makes sense. So you don't have both of those people in the room in this clinical setting.
Right.
You just have, who's in the room? It's the patient
and two facilitators.
Okay. So talk to me about the patients. How do they get in this program? What are the qualifications? And what is success to you and the team when they move through the process?
Well, Ginger can talk more about the qualifications, like how people actually get to the study.
Sure.
I would say success, well, it depends on what you're talking about. So if you're looking at the clinical study part where you're trying to measure reduction in symptoms, there's a number of measures that I'm sure they use. I'm not in touch with that part per se, but you look at how people's symptoms diminish over time, hopefully. I think also what we're interested in, though, is quality of life and people's experience of the experience and what meaning that holds for them. And people will talk about having these experiences being, equal in importance to them as the birth of their first child or the loss of a parent or, something really monumental that shifts the way that you understand yourself, the way you understand the world, your relationships. So it's really powerful. So I think success from my perspective is that somebody is able to make some sense and add some meaning to that in a way that really is profound for them moving forward, whatever that might be. And it's going to be very different for each person.
Sure. So getting back to your roots a little bit.
Yeah.
So someone who, you can use yourself or someone else as an example, that's suffering from an eating disorder. Going through that experience is the goal that they will have like an epiphany of, I have a different sense of self. That's what I'm trying to understand as a layperson. Like, what would you hope for that person, or how do you facilitate that?
Yeah, so I would hope for that, and I have not done this with somebody with an eating disorder, but I would hope, and what I know of the research is that what it can do for people is give you a radically different experience of yourself and your relationship to your body. It makes the brain capable of making connections that it hadn't made before, make different connections, so it can loosen up some of the kind of rigid thinking and patterns that people can sometimes get into. And just, they describe it, or some people have described it as like if you're an astronaut and you see the Earth from outer space, it's just a completely different perspective on your life, and that can alter the way you feel in your body on an everyday basis.
Which is extremely valuable, because we spoke to someone about a different type of therapy. It was actually sound therapy, and some people, I feel like they identify themselves within their trauma.
Yes.
Where that just becomes their identity, and it sounds like this has the ability to take them out of that identity and view themselves in a much different light.
That's right.
And grow.
Yes.
And the science behind it is so valuable because it is showing quite vividly in some of the graphics that there are reconnections or different connections within the brain. That is what is so powerful.
Yes. And I think with addiction and eating disorders and other conditions where it's very easy for the person themselves and people around them to kind of conflate them with that illness and have a difficulty in separating out like what's the addiction, what's the person, that this kind of therapy has the potential to really help people open that up in a way that can then, with therapy, continue to develop in ways that maybe they couldn't have before.
So based on your experience as a therapist in treating people with eating disorders and potentially other situations or addictions or what have you, are there specific things going on in the brain that led to that condition, traumatic events, or was it more of a progression of occurrences that got them there? Can you speak a little bit to your experience in dealing with patients?
Sure. So oftentimes for someone with an eating disorder, for example, occasionally there can be a singular traumatic event that can produce some symptoms, but often that's not the case. Often it's an accumulation of things over a long period of time that have to do with how the person experiences their worthiness to exist. And that can look different for different people. It can be something that, emerges within a family, with peers, certainly with cultural messages that we get about who has the right to take up space and who doesn't, or, who has the right to get attention and who doesn't, and, all these things, who's valuable and who is less valuable. So it's an accumulation of things, but what it culminates in usually is a person who is feeling so much self-loathing and self-hatred and confusion about what is my point? Like, what is my purpose? And how do I exist in a world where I feel like I'm not valued, or I'm being told I'm not valued? How do I make sense of my existence? And so these are big existential questions, right? That people are really grappling with. It's not just about, I want to look like so-and-so on Instagram or whatever. I mean, that matters, but that's not really what's at the heart of what's going on. It's these really deep questions about what it means to exist. And so you can see how with psychedelic therapy, there's this huge opportunity to really open these things up and help people think about them differently, experience them differently, not just think about it, but have the experience of existing differently and recognizing that, a new perspective on who they are in the world. And this can really start to help move some of the therapy forward in terms of grappling with some of those deeper issues.
Absolutely. And I've never thought about an eating disorder in that
Yeah.
way. You do think of, it's clear to see the societal pressures of looking and feeling a certain way, and there's so much attention and I guess, idolization of people that look and appear a certain way. That's what you think of naturally when you're not close to these types of people experiencing this.
Right.
I've never thought about it from a self-worth, like being on the planet type of a situation. That is, to me, it's so deep, like you said, and it's so earth-shattering and so heartfelt and sad, honestly.
Yeah, it's very sad.
It's very sad. So to think that this has the possibility of really reframing that person's perspective, completely changing their outlook on themselves in life, I'm sure it is extremely motivating.
Oh, I'm so excited about what's happening in the research, yeah.
And so obviously you're passionate in that area. Who gets the vote on what types of people that you're going to target? Is it eating disorders? Is it PTSD? Is it people with pain? I mean, I've heard of different modality or different ideas of how it can work. Who gets that vote?
Ginger. Mostly because she's got the infrastructure. She's the medical doctor, and she writes the grants. So really, it's the people with the money who get the vote. You have to, you apply for grants to do this kind of research, and there's, like anything else, there are certain conditions that get more research funding and certain conditions that are deemed less important that get less research funding. So it's a whole kind of mix of things that determine what conditions are being researched and where. So, yeah.
That's fascinating.
Yeah.
So it's a lot of probably vying for attention, so to speak, with
That's right.
funds and that type of a thing. Stepping back into your personal training to be the clinician in the room and managing the studies, and can you talk a little bit about that training process?
Sure, it's fascinating. This is my first time going through it. So I was, as an anthropologist, also very interested in how are they going to teach people to be a facilitator or guide? Like, what do they consider important? What are And so it's many, many, many hours. I don't even know how many hundreds of hours it is. It's a long training with lots of different modules that you do, some online, some in person. And it's really delving into the psychobiology of what's happening in the brain, a lot about the interpersonal relationship in the room and how to try to set the stage so that the person has the most comfortable experience, but also the most authentic to them. So there's a lot of different components about, and then the different stages of the process about the dosing, and then during the time they're having the experience, and then the integration. So you're getting training around how to manage things that might come up that could be challenging. So there's a lot of different components to it. Not as much about the history of psychedelics and kind of the indigenous knowledge that exists around these, a little bit, at least in the training I'm doing. I'm sure there's many different trainings that exist, but at least in this particular training, there's not that much about that. It's acknowledged, but as an anthropologist, I would have liked to see more of that.
Sure, absolutely, because that is so important, not only for the recognition of all of that knowledge and practice over the years, and I hear that is something that is also of importance to those indigenous populations.
Absolutely.
They want that recognition.
Sure.
They want reparations for this type of work. So, I mean, I started researching a little bit about that. Have you had any conversations or exposure to those populations at all? Or is that more Leo?
That's mostly Leo. I have some, but not as much as him.
Yeah.
Yeah. But I know, I mean, it is a point of tension for sure, because this has been around forever. And people have very elaborate cultural systems, that incorporating them. And from their perspective, I can understand, here comes Western science saying, oh, wow, here's this cool molecule in this mushroom, and we're going to patent it, and then we're going to sell it. And we're going to, and they're like, wait a second, like and we're going to build all this knowledge, and there's already a lot of knowledge. So it is a point of tension, and I think there's a lot of conscious work around trying to do that better. So that's good.
And I think that is good. I think certainly, if it's been done for millennia, as you have stated, there should be recognition that this work is there. It's becoming more modernized and focused on at this point in time because of the potential benefits. And then, the capitalistic society, and they're going to come in, and I mentioned and asked you about this earlier. Right now, it's you, it's Leo, and it's Ginger. You are the three-legged stool.
Yeah.
And can you talk about how the three of you work together, come together, discuss the research?
Oh, yeah, sure. So Ginger, of course, is a psychiatrist, so she's coming from that medical perspective and the psychiatry perspective. I'm an anthropologist. I come from the cultural perspective, and Leo is a PhD in social work, and he's coming from more the implementation perspective. So all together, we're kind of addressing, it's a multidimensional issue, right? And so we're trying to, with our different expertise, get at different sides of these questions. So when we have a discussion around the current research or something like that, we all bring different sorts of questions and different interests to the same, set of issues, and it's a really rich and productive collaboration.
It's fascinating, and as I mentioned earlier also, it's very obvious that there are no business people involved.
Right.
And I asked you if that was by design. Can you talk about that and maybe why that isn't the case now, and obviously why it may be in the future?
Right. So we have a steering committee that's bigger than the three of us, and there are not currently business people on that, but we are looking into that because that is an important perspective to bring in. But as far as for the core group, we really want it to be centered on the research and on the questions about how to help people, and not so much the business side. That's for later.
Sure.
Or for somebody else to maybe deal with.
Absolutely. Yeah. Because you're going to have your advocates that want this groundbreaking research and modality of treatment for people to really bring them to a better quality of life. But you're going to have your adversaries.
Absolutely.
You're going to have the big pharmas who rely on the prescription or monthly subscription of chronic conditions that obviously they don't necessarily, they might want it intrinsically, but from a business perspective, they rely on that for their livelihood. So that's going to be an interesting conversation on how this moves forward. And it's so integrated with, it's future prescription, if you will, with a process. That's
Yes.
different.
Yes.
That's a very different individualized approach to mental health.
Yes.
That is hard to standardize. So I'm sure that is one of the biggest challenges. Can you talk about that? Do you ever talk about that as a
Sure.
group?
Yeah, I think that's such an important observation that, the idea, what the research is showing with these substances is that people can have, one or maybe two treatments and really see a dramatic reduction in symptoms. So it does have the potential. We don't know long term, there's still more research to do, but it has the potential at least to reduce the reliance on these kind of standard prescriptions that exist. So yes, there will be detractors. From that perspective, people who are concerned about the long-term effects of these substances or concerned about just the fact that it's such a dramatic experience and wanting to make sure that that's safe and, which all of that is reasonable.
So speaking from personal experience and thinking about how things have changed over the course of a number of years, when you obviously went for treatment yourself, you were 11, you were 18. Tell us a little bit about how those, at that point in time, those traditional, I guess, if you will, methods of treatment have failed.
Yeah.
If you could speak a little bit about that, I think that would be
Absolutely.
helpful for people to understand.
Sure. So when I mean, this was a while ago when I was in treatment myself, but it was at that time, so this was in the 80s and in the 80s, the focus was very behavioral focused. Just change the behavior and then you're better. And that's not really how it works. Like you can get somebody with an eating disorder, for example, to eat a certain amount of calories per day, gain a certain amount of weight, but that doesn't mean they're better, right?
Yes.
We still have that problem. With the advent of managed care, in particular, they're very interested in what can we measure and how do we track progress, which I understand from a business perspective, but humans don't work that way. So, still even today, the focus is on, what is the weight, what do the labs say, what is the blood pressure doing, these biomedical markers, which are very important, but they don't tell the whole story at all with what I was saying earlier about these being really deep existential distress that people are experiencing. So we still have that problem in our current mental health system, particularly with eating disorders, other things as well, but particularly with these conditions, that we are not really treating the problem. We're treating the symptom,
Correct.
but we are not treating the problem. And so one of the potentials with psychedelic therapy is that it allows us to get to those places a lot more quickly. I mean, traditional therapy is great, but even that does not quite often get to that really deep existential place. And psychedelics have the potential to open that up. And then, of course, that will require further therapy. That's not the only solution. It's not a magic pill or anything like that. It still requires support and continuing therapy, but it can touch places that our behavior approaches don't. And psychotherapy takes a very long time to get there.
I agree with that. And even in the most recent article that I read about the Healthy Mind Lab, one person spoke about, someone might have a religious experience because that's their belief system. And then someone who is an atheist might have a completely different experience because that's their belief system. So you're really getting at that core.
Yes.
That might have nothing to do with eating or addiction or whatever.
That's right.
But it is that very deep, like you said, you go deep, it's intrinsic, it's your belief system, it's your value system. Why are you here on the planet and what's your worth?
Yes.
That it's getting to, which is so different. It's treating that problem
That's right.
that's resulting in those behaviors. And I think that is extremely promising.
Yes.
A little scary, probably, for people.
Sure.
And speaking of that, what are some of the risks? Because obviously, this was a hot topic back in, what was it, the 60s, whatever it was, the time frame. Then it was like, whoa, this is bad. And now it's coming back into, I don't want to say popularity, but it's getting attention
Right.
for what I feel are the right reasons,
Right.
because of the potential health benefits, the mental health benefits. So what are the risks that you
Right.
are trained on and that you've maybe seen with
Right.
this?
Right. So of course, with anything that's going to produce such a profound experience, there are risks that somebody could have a negative experience, for example. Part of what you're trained as a facilitator is to help if somebody is having a negative experience, to help to reframe it. If somebody is really struggling, there are medications that you can give to kind of stop what's happening. So there are guardrails. So somebody's not just going to be left having a horrible trip. Like there's things to address that. It's rare. That doesn't happen very often. But I know that that's something that people are concerned about, which is understandable. But I think it's also worth thinking about why it seems so scary. And I think, I won't get into all the history, but if you look at what happened with the research that was happening in the 60s and why it got shut down, it was not necessarily because they were dangerous. There were lots of political and social reasons why this anti-psychedelic movement happened. So I think it's worth kind of learning a little bit about that, and that might help contextualize a little bit. Like, we don't really have to be afraid. I mean, we should be sensible and we should be cautious because they're powerful, but we don't have to be afraid.
And that is great to provide that context, because it probably was something that was shaped by the media or what was happening at that time. And that can be unfortunate when that impacts the entire population's vantage point of how things can be utilized for good. Now, you mentioned that there are medications that you can give someone that's in the room when it's happening. Like, you're giving it to them while this bad trip is happening.
Well, a clinician, a medical person does.
Correct, a medical person. Not you as in the medical person in the room. And that just has an immediate...
From what I understand, ask Ginger.
Okay.
She can speak more to that.
Fascinating. Wonderful. And do you even know, and this is kind of off the wall, where did the term trip come from? Do you have any idea?
Oh, I can guess. I can guess definitely, because if one has ever done psychedelics, then you know that it is a journey. It is a journey. It is an experience. You can feel like you're not who you are anymore, not usually in a scary way. You go on a journey. And it's interesting because in a lot of indigenous cultures that utilize these kind of substances too, for shamanistic purposes, they talk about the shaman going on a journey. So this has been part of our lexicon, our language, for a very long time, this idea that you're journeying to another place.
Has there been any thought of bringing those indigenous populations into the lab?
That is such a good question. We haven't talked about that specifically. Well, we have some. Let me backtrack on that a little bit. On our steering committee, we do have some.
You do?
Indigenous folks, who are scholars as well, and so they are involved. We need more.
Yeah,
we need more, but we do have some, but it's not enough, I think.
Yeah, that's interesting, just to have that representation and that tribal knowledge.
Absolutely.
To impart to everyone else that's on the team. I think that could be very interesting.
Very valuable.
And to get their vantage point on how they feel the work is progressing.
That's right. That's right.
So bringing this back into today's environment, where we have now as a society, at least within the United States, come to accept things like marijuana. We've gotten to a place in most areas where it's becoming just, we're like, okay, we're okay with this now. It's taken a while to get there. People were, I think, scared of it, and were afraid of the ramifications of what if we legalize this.
Right.
Explain to us how you view psychedelics in a comparative way, and how it's so different from that type of acceptance, and how we need to look at this in a different manner.
Well, they are, like I said, very powerful substances. So we want to be cautious. We want to be careful about how we are legalizing them or how we're regulating them or whatever we're doing. And it's really important, as these become more accepted, to recognize that it's not something that someone should necessarily do in isolation and expect that to have the therapeutic benefits. It might. I mean, you never know. But really, it's part of a larger process. And it's really important to have that structure around it and the guidance to do it, or at least knowledgeable people who are accompanying you.
As part of the commercialization process, do you feel that this type of therapy will only be approved if it is in that collaborative format? It's the drug and it's the person guiding the experience. Is that how, number one, you think it'll be approved, and do you feel that that's necessary?
Yes, I think that's how it'll be approved to start, and I do think that's necessary. I think ultimately, of course, there will be people who are using it not in that context, and there may be benefits that way too, but there's there's more risk. So I think people just need to be really educated about what they're doing and what to expect.
And I feel like for us as a society, there's going to need to be that research for people to get over the hump of the stigma, because it's there. Whether or not we say it's worthy of having that stigma or not, it's there.
Yes.
Because of what's happened in our society. And, quite frankly, someone who's never done it, it scares me a little bit. Like, I don't know if I'm going to have a good journey, I'm going to have a bad journey, or is it going to reveal something that I really don't want to know?
Right.
So,
right.
I think, obviously we're trying to address mental health problems. I'm not suggesting I have a mental health problem better or worse than anyone else. I feel like I have a pretty healthy brain, but you never know. In context, what if I want to, say I have a ton of money I want to blow on a new therapy?
Yeah.
I mean, how is that going to be managed versus the people that really need it? And maybe that's more of a Leo discussion.
Yeah.
But there's going to be that element of
Definitely.
It's going to be a fun new thing to try versus people who really can benefit from that.
That's right. People are already doing this. They're going on
they
ayahuasca trips and
sure.
all that stuff. Sure.
Absolutely. And so that's bubbling up more than ever.
Yes.
Even as we talk about this as an organization, people are like, oh, hey, I know this person, reach out to this person, reach out to this person. And so the pace at which this becomes commercialized based on the research you're doing as a team is going to be very interesting to watch.
Yes. And there will be increasing pressures from managed care to modularize this.
Of course.
And we have to be very cognizant of that and wary of that, because this is not that kind of a thing. It really needs to be part of an integrated approach.
Which is tough.
Yeah.
At the end of the day, that's a tough thing to manage.
Yeah.
It's not, it's not a little factory.
That's right.
So
exactly.
That's where it is art and science.
That's right.
In a typical scenario where a patient is taking a medicine and expecting the symptoms to go away, in this modality, we're talking about taking a drug, it might eventually be a prescription, and working with someone through the process, where it's so much more than just treating what's going on in the body. It's what's going on in the brain, both with the medicine and with the help of someone else.
Yes.
So you're dealing with people who are, a lot of times it's traumatic, it's a mental health problem, it's something that's very, very serious. So how important is that role in getting through that healing process and getting them to a hopeful state that will change the trajectory of their quality of living?
Yeah, it's extremely important. I think one thing we don't recognize very much in American medicine and Western medicine is that all healing is interpersonal and social. All of it, whether you're going in to have heart surgery or you're taking psilocybin. I mean, it's all about the body, certainly, but that's one component of what's happening. It's somebody's social world, it's their relationships, it's their experience. And so with these kind of medications, it actually has the opportunity, I think, to change the way we think about medicine more broadly in terms of the importance of combining medical interventions with psychosocial interventions in a way that really will give us the best outcomes.
Correct. It's unleashing the potential.
That's right.
I feel that that's the best way of looking at it. You've got that physical part that's going on, and then you have that spiritual, emotional. Spiritual is relative, but mental and emotional process. That if you get the three of them to work together, you really can get to a much better place than relying on just X is going to produce Y, type of a thing. Right. So I think that is neat to think about it that way. That it's not just in this situation, but let's think about that with other modalities of treatment.
Right.
For those in the audience that want to learn more about the research you're doing in this space and potentially otherwise in other areas, where can they find you?
Well, my faculty page at Washington University is one spot. I have another personal web page that's RebeccaLester.com. And my therapy web page is lumantherapy.org. So people can find me there.
Fantastic. And I would encourage all of you to go out there. I went to your personal page, and most people have like a 2-page resume. Your resume is like a scroll. You are extremely accomplished, and we appreciate you speaking with us because you have such a wealth of background, acknowledgement, and just a wealth of experience in many different areas. So this is just one of them. So again, we thank you for your time and insight into this incredible research, and we wish you the best and hope that it gets to a point where you feel it's been successful.
Wonderful. Thank you so much for having me.
Absolutely. You've been listening to Life Beyond Loss, a podcast from Survival in the Trenches. If you'd like to get involved and help those struggling to cope with personal loss, visit us at our website, survivalitt.com, and follow us on social media. Don't forget to subscribe and share this podcast so we can continue to grow and reach more people in need. Together, we can make a difference.